What's the difference between a cash-based and an insurance-based physical therapy clinic? And if you want to work at a cash-based place, what are the pros and cons? So in this video, because I work at a cash-based clinic, I'm going to tell you about all of those details. So let's get into this. Lego. What's up everybody? My name is Dr. Justin Lee, physical therapist. I'm a PT school admission expert and I help students get accepted into PT school. In this video, we're going to talk about my job here at Village Fitness in Glendora. This is our first location, but we're looking to expand. And I'm going to share with you my insights on the pros and cons of a cash-based clinic like where I work, and also the differences between what a cash-based and an insurance-based clinic is like. So let's talk about that. Cash-based versus insurance-based, what are the differences? So typically when you become a physical therapist, you're going to be working in an insurance-based model. Now, most clinics are like that because, people have insurance and they want to pay for it, and that's just easier to get revenue in, right? Makes sense. You got insurance, go to the doctor, oh, I have some back pain. All right, I'm going to refer you to PT, go to your insurance like Kaiser or Anthem Blue Cross or whatever it is. Then you go to the clinic that takes those insurances and then you go get treated that way. That clinic will get reimbursed from that insurance company, and that's how they make money. Now, on the other hand, in a cash-based place, let's say you go, oh, my back hurts. You don't have to go to your doctor or any other provider to get physical therapy clinic or physical therapy services. All you have to do is literally just walk into the clinic, into our clinic, and say, Justin, my back hurts. Can you help me? And instantly, we're able to treat you just right then and there. So that's one of the big differences. Another difference is the amount of volume. There's so many people that go into that insurance-based clinic. I'm sure if you have had physical therapy services, you've experienced this before yourself. You go in, maybe you get the evaluation in a room by yourself with the provider, but then after that, you're in a big place with a bunch of other providers, physical therapy assistants, physical therapy aides, and other patients all working out or doing some hands-on at the same time. Now this might make you feel a little apprehensive or kind of like, ooh, that's kind of weird how they're like exposing me, but like in front of everybody. Or maybe you don't feel comfortable sharing that information with your provider, with everyone else around you and listening, and it can be very crowded. You most likely are going to be with a physical therapist for a short amount of time and then hand it off to an assistant or an aide to carry out your services. Now, if you're watching this video and you are thinking about being a physical therapist, you've experienced in your volunteer or at working in the clinic, that's what happens. Physical therapist sees them for about 5-10 minutes and then hands them off to you and says, hey, take them through their exercise list. And that happens over and over and over again, almost seeing 2 or 3 patients every single hour for 8 hours a day. That's up to 28 patients. Wow, burnout, you don't want to go there. Now, on the other side, cash-based clinic, at least what we do here, we spend 50 minutes, close to an hour with every patient, one-on-one with the doctor or physical therapist. There are no assistants, there are no aides here, and we give our undivided attention in a room just like this. We got the air stuff going on, the aromatherapy. We got the ambiance of having the dimmer lights go down and up. And we got different ways to make sure that our service is elevated to the highest quality level. Now here, like I mentioned, you are working one-on-one, so you're gonna have that attention, and it's not populated. I see, if I have an 8-hour day, 8 patients, 1 patient an hour, 10 minutes at the end to document, and definitely don't take any documentation home. So those are the main differences between a cash-based and an insurance-based physical therapy clinic. Now I'd love to talk about the pros and cons of my job at a cash-based clinic. So let's talk about the pros first, because I always love talking about the great stuff, and then we can talk about the not so great stuff, okay? So number 1, in a cash-based clinic, you are not constrained by insurance. Now this is a really big leveraging point that really motivated me to want to go to a cash-based clinic, because when you go to an insurance-based clinic, you're given a referral that says, hey, you're able to treat this person twice a week for the next 4 weeks, 8 sessions total, and you can only do these type of things. And doctor will kind of check, make you do like modalities like ultrasound, e-stim, manual therapy, therapeutic exercise, all these different things. Sometimes they give you the freedom to do what you want, but you're kind of constrained to a certain amount of sessions and things that you can do. Also, when they get referred, they'll get referred to like just one body part, like the neck, right? You have neck pain, you go in, okay, they're only treating the neck. Now here, because we're not constrained by insurance and we don't have that third party, we work directly to the consumer or the person coming in. We literally have the freedom to do anything that we want. We can do hands-on therapy, anything, exercise. We lift weights here. We do barbell squats, deadlifts, overhead press, bench press, all those things here. In addition, we do a lot of manual therapy, right? And we're not constrained by what body part. Like if you come in for neck pain and all of a sudden you're like, I stepped on something wrong and my hip or back really hurts, we can use that session and shift over and work that into our treatment plan. And the coolest part is that, let's say we make a recommendation, let's say 2 times a week for 4 weeks as well, but you want to do more and you're like, I'm really getting a lot of benefits from this. Can I do more? Instantly, we're able to add more into your plan. And all you have to do is make the decision if you want to purchase that or not. On the other hand, with the insurance, if you want more and you're like, I really need more, then you have to get referred back to your doctor. Then your doctor has to approve it. Your doctor might approve it, but then the insurance might not do that. And maybe you're SOL and that's just all you have. You're out of luck, right? And that's just it. And bye-bye, twice a week, 4 weeks, you're done. That's a terrible model, and I really, really don't like how physical therapists are constrained by this big king and queen, this big companies, these insurance companies that don't allow physical therapists to really do what they have the power to do, which is to heal people, to use hands-on and their own body to heal itself, to get stronger, and to restore them back to their prior level of function. Now, like I mentioned earlier, another pro is that if people want to keep paying, they can keep coming. They're not constrained by insurance, and if they just want continual therapy or just like a maintenance type of thing, like our cars need maintenance and they need to keep on going, people can do that. As long as they want to pay, they can keep coming. We're not going to say no. Now, here at Village, I want to talk a little bit about our business model and how that can be helpful, and how we do that here. So somebody comes in and they go, oh man, they're deconditioned, and because of their deconditionedness, their lower back really hurt. They were totally fine, and then before you know it, like all of a sudden they went on a long walk or they picked something up and oh, their back got strained. And this isn't the first time, this is multiple times happening because of how deconditioned and weak they are. So then they come in, and the first step, what they would do is come to physical therapy so we can help them out. We can help them out with their pain, their limitations, their weaknesses, their range of motion, all those fun stuff, and basically get them back to feeling pretty much normal, right? But what was normal for them? They were weak and deconditioned, and that's why they hurt in the first place. So then our model moves on to the second part, which is our one-on-one coaching. So they get transferred over to a fitness coach here, and they work one-on-one with them, knowing the exact limitations and weaknesses and impairments that the physical therapist has identified. Now the coach is working with them to get them stronger, more flexible, more mobile, and all those different things. And now once they feel like, okay, I'm pretty good, I'm much stronger, I'm independent, now at that point, they need to be able to live out an active lifestyle. So at that point, they will be referred one more time to small group training sessions. And these small group training sessions are amazing because it helps people stay regular and active and be able to sustain an active lifestyle with weights, baby. Lift for change. So they're doing barbell lifts, squats, deadlifts. These people that are 50, 60, 70 years old are deadlifting hundreds of pounds, and I love it so much. This business model that we have here as cash-based physical therapy is amazing. And the fact that if somebody gets maybe injured or something hurts along the way in their fitness journey, they can easily come back in-house and come to physical therapy again, and we can help them overcome that injury so that they can continue to stay active again. So all the pros are good, but Justin, what about the cons? Tell me about the bad things about cash-based physical therapy. Okay, so here we go. The first thing about a con of being in a cash-based clinic is that people are paying a lot of money, right, for these services. So you always have to be on your A game. You always have to be super attentive and listening to them. You have to have high communication skills. It's high service and high quality. I mean, we are using high level stuff. We're using the most premium blends of aromatherapy. We're using the most premium blends of cream to go on them. We're doing a lot of hands-on, right? Which is pretty prestigious and premium versus a lot of other clinics because they just kind of watch you and do some exercises, or they tell the assistant or aide to watch you, and you're not getting that quality service from a doctor or physical therapist. So that comes with the price. And although that's great for you as a consumer, but for me as a doctor or physical therapist, I gotta be on. So I'm listening, I'm active, I have high energy, and as soon as they come in, we're going to work right away. So that's number one. Number two, like I mentioned, it's a lot of hands-on, a lot of manual therapy. So, you really got to protect your thumbs and your fingers. So you got to get creative in the way that you use your elbows and your wrists and your knuckles, but also that can do a lot of wear and tear on your body. Now, I do work out and, I stay active, but man, I just realized no matter how much you work out, just doing a lot of manual therapy can have some wear and tear. So that's something that you have to be aware of, but people pay for hands-on. So that's just something that you have to consider when going into a cash-based place. Now, of course, this is the big part about a cash-based physical therapy clinic, is that you gotta sell it, right? So if people are willing to pay, they're gonna keep coming to you, but you gotta convince them that your services are worth the amount of money that they're paying for. So you gotta learn a lot about just tapping into why they really need your services. You have to sell yourself, you have to overcome barriers, right? And you really have to learn how to have some negotiations, right? If they say no, and when you make an offer, that doesn't mean that no is the final answer and you're like, oh shoot, okay, that's it. But to kind of be courageous and press into that a little bit. So selling services, that took so long for me to master, because in an insurance-based model, people come to you no matter what. They pay maybe a $10 copay and that's it. But then here in the cash-based clinic, they're paying a lot more than that, and that's per session. So you better make it worth it for them. Okay, lastly, a con, and something that I get told a lot, is they'll come in and they'll say, okay, your places look good, but I have insurance, and why should I come to you versus going through my insurance and going to Kaiser or going through whatever other clinic? And so those are the conversations that we have to have and overcome together, and sell services to be like, hey, you know what? You may get insurance there, but it's what it's like over there, and this is what we offer, and there's different strategies to overcome that. And it can definitely be a challenge, and it really sucks because you know that you can help this person. I know that I have the tools to legitimately help you, get you out of pain and get you back to what you want to do, but because you're like, I want to go through my insurance, it's very heartbreaking for me to sit there and accept that because I know that I can help. And are the other therapists as qualified? Maybe, but I'm sure you've experienced this. There are other physical therapists that are not qualified, that don't do a good job, that get complacent and just really say, you know what, you're just another patient. I'm going to see another one just like you in the next hour, so I don't really care. But here, in what I do, I care. We care as a company, and every single person that comes in, we treat them like they're our mom, they're our friend, they're our dad, they're our grandma and grandpa, and we deliver the highest level of service that we can. Now, for those of you who are watching this video all the way until this part, this is just something that I had in my heart that I just feel really compelled to share. Now, I don't know if you have a faith or not, and I'm definitely going to go there right now in this video, but I'm a Christian. I follow Jesus. He's my Lord and Savior, and I know that I was created to serve other people to the best of my ability. And I want to steward my body and my knowledge well to be able to heal people. I'm a healer, right? And what's super cool about being in a clinic like this is that I get to heal and use all the tools that I possibly can go through in my schooling and in my experiences to do anything that I can to help you. And forever how long it takes, let's do it. Let's freaking do it. Because I'm just a steward of my body to help heal and to glorify and expand His kingdom. And so if you're coming in, the ones who are blind, the ones who are bleeding, the ones who are crippled and paralyzed, and just like how Jesus has healed them, I want to be like that too. And I want to steward my body well to heal the people that are coming in, that are in pain, that are aching, that just feel like hopeless, that they have nowhere else to go, that I can be a vessel to help them move forward. I just had to get that off my chest. The Holy Spirit was moving in me. But y'all, this video was kind of long, but I do appreciate you watching all the way till the very end. All about cash-based clinics and insurance-based clinics and the pros and cons of that. So I hope you enjoyed this video. Please subscribe to my channel and have a great day.